Hi everyone! In today's video we're going to be working with some dynamic balance exercises, and then I'm going to be taking you through a short demonstration of the best way to get up off the floor if you have had a fall. Now, while a number of these exercises may not be directly relevant to you right now, there is definitely going to be someone in your life at least that these videos or these exercises will benefit. So just have a watch through and try your best with some of the exercises. I'm definitely going to be giving you variations if any of the exercises are a little bit too challenging. So we'll start with the easier version and then I'll give you a demonstration of a more challenging exercise. So to start off with, we're going to come all the way up to standing. So I'm going to start with my feet hip distance apart here, and then all I'm going to do here, first of all, is come right up onto my toes, and then I'm going to carefully lower my heels back down to the floor. Now, if this is too much to start off with, you can absolutely have a chair next to you to use for stability as you come right up onto your toes and then lower back down to the floor. Now, just here, make sure you're paying particular attention to coming up onto all 10 toes, if you can, without pain. So remember, don't push through pain. If you are experiencing any pain in any of these exercises, stop what you're doing and do let me know so that I can give you a variation to work on improving your strength. So here, I'm just coming right up onto my toes and then lowering my heels back down to the floor without a clunk. So control that lower back down. The second exercise here, we're going to go into a little 4-foot raise off the floor. So it's not a huge movement. All I'm doing here is I'm spreading my toes out, lifting my toes off the floor, and then very briefly, in a really controlled way, I'm lifting my 4-foot off the floor. So it's a little rock back onto my heels, and then I'm placing my 4-foot back down. Now, if you are feeling a little wobbly with this one, definitely hold on to the back of the chair. So 4-foot lifts off, and then lower back down. And I'm going to go for 3 more here, and then we're going to make this a little bit more dynamic. And 2, and 1 last one here. Okay, from here, I'm coming up onto my toes, and then I'm rocking back onto my heels. Now, this is a challenging one for balance, so just go to your limit with this one. Lifting the toes off the floor, then lifting the heels off the floor. So really try and rock back towards your heels and then rock right up onto your toes. So we're going to go for 3 more here. Don't worry if you're losing your balance a little bit. This is a really good one to start strengthening through our dorsiflexors. So the main muscle for that is our tibialis anterior, which runs right along the front of our shins. Okay, now from here, we're going to work on strengthening the front of the shins, so these little muscles right at the front of our shins just that little bit more. So what I'm going to get you to do with this first one, keeping knees and toes tracking straight ahead, lift the toes off the ground, and we're going to take a few steps forwards, keeping those 4 feet off the ground, and then come all the way backwards. So just doing little stomps forward on the heels, and then walking all the way backwards. Now I'm just going to show you side on. My 4-foot is off the ground and I'm taking little steps forward like a little penguin, and then I'm walking all the way backwards. And 1 more in the forwards direction, little steps forward, balancing on my heels, and then walking backwards. Now take a rest for a moment here. You can do little alternating calf raises to give it a little stretch through the front of those ankles. And now here, we're going to continue to strengthen through the front of our legs by turning the toes outwards like a little ballerina. So toes are turned out towards the sides. And again, I'm going to lift my 4 feet off the ground and do little marches forward. So now we are in external rotation of the hips. So toes are turned outwards and my knees and toes are turned outwards. And I'm taking little stomps forwards and backwards, really strengthening through the front of the shin. And I'll show you shortly why that's really important. Little steps forward with those 4 feet lifting off the ground and then coming backwards. Of course, if you are getting fatigued, take a little rest here because there is more to come. Okay, final movement with the little shins. I'm going to internally rotate through my hips here. So I'm still standing up tall, but my knees and big toes are turning inwards towards each other. Now from here again, now this is the most challenging one. I really struggle with this little one. I'm going to lift my 4 feet off the ground and do a little march forwards. Ooh. And that is challenging. So if you are struggling with this, don't worry. About 12 to 15 stomps forwards and backwards in total. And 1 more little set forwards. And 1 last little step backwards. Beautiful work. Okay, give those ankles a nice little circle. Keep up the mobility through those lower limbs. Nice little circles here. And now we're going to challenge ourselves a little more now with more reaction time. So the first exercise here is going to be a long step forward. So I'll turn on sideways so that you can see me just that little bit more. So what I'm going to do here is I'm going to take a step forwards and then return all the way back up to standing. So a lot of the time we lose our balance if we're forced to step forwards really quickly, if we really need to catch ourselves by stepping forwards. So doing movements like a long step forward and then pushing back to standing is a really good way to bring some strength and dynamic stability into our legs and body in general. So a little step forwards might be enough for you, just stepping forwards and returning back to the standing position. I'm staying on my right leg to begin with, so make sure you're not alternating legs. If you would like to challenge yourself a little bit more with this weight transfer, you can go into a long forward stepping lunge and then push back to standing. Long step forward lunge, push back to standing. Always make sure you've got something to hold on to nearby if you need it. We're going to do one more on this right leg. And then we're going to switch over to the left leg. So now I'm just going to take a little step forwards on the left side and then return to standing. So really transfer the weight to the leg at the front and then step back. Transfer the weight forwards and step back. And if you're feeling confident, take a longer step into a lunge and then return to standing. Long step forwards into lunge, return to standing. We're going to do two more here. Woo, it's challenging. And last one here. Excellent work. Okay, moving the weight behind us now. So now I'm coming forwards a little bit and I'm going to take my right leg backwards first into a little step behind me, transferring the weight onto the back foot and then pushing forwards to standing. Take the foot back and then return to standing. And of course, if you want to challenge yourself a little more, take it into a lunge and then return up to standing. Step back into a lunge, push off that foot and return to standing. We're going to do three more. Long steps back with that right leg, and two, and one last one here. Beautiful work. And now we're going to go over to the left. So with the left, I'm taking a little step back first, and then returning my feet back together. Little step back, return the feet together. So remember, if this is enough for you, that is absolutely fine. However, if you would like more of a challenge, take a longer step back. So go into a long lunge, and then return back to standing. Long lunge back, and return to standing. And we're looking at that front leg stability here. We don't want that knee moving all over the place. Long step back, return to standing, and let's go for two more, either step or lunge back, and one last one here. Beautiful work. Now, this is where it starts to get a little bit tricky with this next balance exercise. I'm going to start really gently, and remember, you can take a stick or any little broomstick, anything that you can hold on to would be great, especially if you're a little bit shaky with your balance. We're going into a grapevine. So I'm going to go with my left leg over the top of the right leg back. Left leg goes over again, right leg comes over, and we're going to go one more this way, and then come back to standing. Now going back over this way, I'm going to go right leg over left, left leg back, right leg over left, left leg back, and right leg over left, left leg back. Now, if you would like a little bit more of a challenge with this one, take longer steps, but keep your hips square to the front of the room. So this is a really good exercise for hip stability. And if you are a little bit shaky with the hips, this can be quite challenging. So really make sure that you're keeping your knees and toes tracking straight ahead and try not to swivel your body to turn off to the side, because it's actually surprisingly challenging. So going into your really good little grapevine steps here. One last one, we'll go forwards and backwards. So really challenge yourself to walk in the most elegant way possible. So you really want to stay up tall and keep your hips tracking straight ahead. And last one here. Now with this next exercise here, I will give you a few options. This is very similar with this grapevine, but we're going to turn it into a little bit more of a hip stability exercise. So my left leg is going to go back behind my right, just a little step back, and then return to standing. Little tap back behind the right leg and return to standing. Now, some of you will have done an exercise very similar to this at the gym. So if you would like to make this a little more challenging, go into a curtsy lunge. So you're going to take your leg right back behind the other and then sink a little lower. And if you're doing it correctly, you should feel the stationary leg's bottom really working hard. So we'll go for 5 more. So we make it about 10 per side. Curtsy and return back up. And let's go 3 and 2. Really well done. And one last one here. Excellent work. We'll go straight over to the other side. So now this side is going to go around behind the other leg and then return back. And then around behind the other leg and return back. Now if you'd like more of a challenge here, go into a long curtsy lunge. So leg goes right behind the other leg on the angle and then return back to standing. And we'll go for 4. Really well done. Try and keep your shoulders and hips square to the front of the room. 3 and 2 and one last one here. Fantastic work. Really well done. Okay, we're going to go now into the getting up and down off the floor. So I'm going to recommend that if you do want to practice this, that you've got a nice clear space. And there are a few things that I should mention as well. So of course you do want to be getting up as efficiently as you can if you ever are in the situation where you have had a fall. However, a lot of the time we do panic when we're in a situation like that. So if you do find yourself in a position where you are on the floor and you've tripped over something, or you've had just a moment where you've come down onto the floor, take a little moment to stabilize your breathing and bring your heart rate down a little. So just take a few deep breaths, breathing in through your nose, exhale out through the mouth, breathing in through the nose and exhaling out through the mouth. So just take a moment to calm yourself down a little bit, because we can be really frantic and really exhaust ourselves immediately trying to get up and down off the floor. So starting off, you're most likely going to be in a position where you're lying on your side, exactly like this. And what you want to be doing is noticing first of all if you are injured. So making sure that you've got no broken bones, or at least you're not in significant pain in any part of your body. So take a moment to just calm yourself down, evaluate how you're feeling within your body. And then if you establish that you are in a safe position to be coming into a seated position, roll yourself onto your side first of all. So once you are lying on your side of your body, you then want to be bringing your strongest arm down onto the floor and push yourself up into a semi-kneeling position. So you're going to be just on the side of your body and you're able to put both of your hands flat on the floor. Now from here, the best way to go is to come into a kneeling position. So take your time to come into this position and just take a few breaths here, because this can be quite an exhausting position to get into, especially if you have had a fall. Now from here, you do want to be moving yourself towards a chair. So take your time to walk on your hands and knees, or if your knees are uncomfortable, you can shuffle yourself over towards the nearest chair, especially one that has cushions or something on it that you can easily move down to the floor if you need to. Now from here, what I like to do is to come up into that kneeling position if you can, and then using your hands on the chair, you're going to walk your hands up so that you're in this position here. Now from here, I'm then going to take one leg out in front. Now make sure that this is your strongest leg. So if you're right side dominant, bring your right leg forwards. Use your hands pressing into the chair. That will be a really beneficial way to get up off the floor. And then from here, simultaneously pushing through your strongest leg and through your hands, you're going to do a little transfer where you push yourself up and bring your bottom down onto the chair. And then take a moment to bring your heart rate back down. Now, sometimes that's too big a feat and you find that you just don't have the physical strength to do that straight away. So I'll show you as well another option. Once you've gotten yourself to your hands and knees, you can bring your cushions, so you can pull your couch cushion off onto the chair or onto the floor, and then you can just take a moment to take a seat so that your back is propped up against the couch, and you can just bring your heart rate back down for a moment while you're seated upright. That's a really good option from there, and then you can make sure you can get yourself back into a position up on top of the chair. So I really hope that this video has helped. I know it's a very roundabout way of explaining it all, but I really would like to do more videos like this if they are helping you at all. Thank you all so much. I hope you have a wonderful rest of your weekend. Bye.